Hi, everyone. I'm Dr. Andrew Heck, President of the Pennsylvania Chiropractic Association. First of all, I wanted to thank our Highmark Committee Chair and past President, Dr. Keith Miller, and our PCA staff for quickly handling the issue with regard to those payment integrity letters that were sent out to many of our chiropractors in the state. I also want to thank all of you for quickly uploading your letters to our portal so that we could send our contact at Highmark the data necessary to inform him on the issue. So without that data collection, we're unable to effectively do our job and make these problems known to insurance carriers. So thank you, everyone. We're also very aware of the issue that many of you have been facing, being denied payment for electric stim from Capital Blue Cross for the code being considered an experimental procedure. Initially, we thought the denial was exclusive to that 97014 code, but we have seen EOBs where that G0283 code is being denied as well. We also know that sometimes providers are getting paid for the 97014 code. So our hope is that there's a system glitch that is causing this issue and that once the glitch is identified, it can be corrected quickly. But we can only speculate on the cause at this point until we get more information for you all. So I don't know about all of you, but I'm sick and tired of having to play defense with these insurance carriers all the time. Even though chiropractors are the most effective first line of care providers for musculoskeletal care, we continue to be treated unfairly by insurance companies. Well, now it's time to go back on offense. We are excited to announce that we will be pursuing a copay and reimbursement reform bill for the 2025-2026 session as part of our legislative agenda. Now, I'm going to share some of the content of this bill with you all, but I do want to clarify some things first. We are shooting for the moon with this bill. I cannot guarantee to all of you that we are going to be able to get all of these benefits as we negotiate with interest groups and discuss with legislators, but I want to keep you on the loop. So let's go through what we're going to be fighting for with this bill. So number one, co-payments or co-insurance for chiropractic services must not exceed 25% of the total fee due to the chiropractor. This means if you get reimbursed $50 by an insurance company, the maximum copay a patient would have to pay for that chiropractic visit is $12.50. This improves compliance with care plans that will lead to better success in patient outcomes for our patients. Number two, reimbursement rates must align with or exceed Medicare rates for comparable services. This means the floor of reimbursement will be Medicare, not the ceiling. Number three, policies must include chiropractic services as essential health benefits, covering habilitative services, preventative care, and chronic disease management. Most insurance plans do not cover these services for chiropractic care, but we think that should change. And number four, prohibiting insurance companies from putting stricter limitations on visits or days of coverage for chiropractic care compared to similar services. Gone will be the days when a patient has 20 chiropractic visits and 60 physical therapy visits, which is insane that there's that big of a disparity. We will be fighting to get all of these items passed in the legislature. This is our holiday gift to you. We will be speaking with many representatives and senators on this issue. What I would love to hear when I speak with the members of the House and Senate is, one of the chiropractors in my district was telling me all about this issue you guys have been having with insurance companies. If I start hearing this, then I know that we are hitting an issue that you guys are fired up about, like I know I am. So we are still in the early stages with this bill, but from now until the early months of next year's session, I would love to see every chiropractor that watches this video start talking to their district reps and senators about the problems we are facing with insurance companies. Of course, speak with them about the other issues we were fighting for with delegation of therapeutic exercise and our scope of practice update. But also, if you are not a member and you're seeing this video, please join. Your membership paves the pathway for the PCA to fight for you, and we need your help. So as we transition and we celebrate Thanksgiving this month, I want to share my thanks to all of your support. The PCA appreciates it. And if you don't mind, if you see one of our team members, Mike, Linda H., Linda S., Arlene, Karen Toner, please tell them how much you appreciate them. They are working tirelessly for you all and are very passionate about chiropractic without being chiropractors themselves. Also, I'm very thankful for all of our volunteers that give up time away from their practices and families to fight for the profession. You are all appreciated. I hope you all enjoy the holidays. Thank you and take care.